What we didn't know, and I didn't know till recently, is that the doctor has been the patient. Grant MacArthur has been battling cancer himself, which as a leading and very well-known oncologist is different. Grant MacArthur, good morning.
Good morning, Neil.
How are you?
I'm terrific and really great to be here and share with the listeners some of my experiences.
How long's it been going on?
So I had my surgery now almost 12 months ago, coming up to the anniversary actually. But I was very fortunate to have a world-class GP. You know, we talk about world-class specialists, but I've got a world-class GP, and he picked up through a physical exam that there's something not right in the prostate, had the PSA test done, it was quite high, and from there it was highly likely that I did have a cancer, so I got worked up and had the surgery almost 12 months ago, and now I'm just terrific.
You a bad patient? A lot of doctors are.
Yeah, yes, it can happen. No, well, I hope not. You'd have to ask the nurses that looked after me, but you know, they were wonderful, and I received great care. But I think hopefully I was a good patient. You know, it's interesting being on the other side, seeing what's good and what way you could improve things. And but overall, I had wonderful care. And our cancer outcomes in Victoria and Australia are absolutely the best in the world. We should be very proud of our healthcare system.
Does it change you as a doctor going through this? Does it change the way you operate? I mean, you've always been a very compassionate and caring man. I've seen that myself. But does it in any way change the way you do your job?
Yeah, it's an interesting question, Neil. I always monitored myself, if you like, professionally about how I dealt with people facing the biggest challenge in their life and to show them empathy and compassion. Look, it's probably gone a bit further now, actually. It's experiencing things yourself. I think everyone wants a doctor that understands their situation, what they're going through, and help them get through that as best they can, and that's what I try to do.
You're going to keep working? Is there any temptation to say, hang on, I'm going to go and smell the roses and catch a wave and ride the bike?
So that thought has gone through my mind for about a millisecond. not a really serious consideration. I mean, I've set some goals now. We in my field of melanoma research, which has had some wonderful breakthroughs in recent years, I actually think we can reduce the number of deaths from melanoma in Australia by 50% before I retire. So that's what I've got my sights set on.
How?
Well, we've got, with all cancers, it's a matter of prevention, early detection and more effective treatment. We need to continue the campaign that we've been involved in reducing the exposure to UV radiation. The solariums are a very important first step in that, but of course ongoing education and prevention is very important. In early detection, people need to have regular skin checks with their GP or dermatologist. But what is quite remarkable, and I didn't quite see this coming, our new drugs now for treating melanoma, I think are going to reduce the death rate from the disease. We're starting to get long-term survivors now, and that's very exciting and something that I feel I can make a contribution to.
When you go through this process, and I've talked to a few survivors about this over the years, what is the most difficult time?
Yeah, look, the most difficult time. Look, I probably breaking the news to my kids was the tough one. And in fact, I like to pride myself in being a good communicator with my patients. I didn't do that particularly well. I just sort of came out, Dad's got cancer, quite bluntly. And
how old are they?
So 14, 18 and 21.
So they're certainly at an age where they comprehend right across it.
Yeah, absolutely.
They're not in medicine, are they?
Oh, my daughter's aspiring to enter medical school, my eldest daughter. But no, they look. It's tough on them. It's there's some tears and I think that was the toughest time. My wife Marie was the Rock of Gibraltar, and she supported me through everything. But it was really talking to the kids was the toughest thing, I think.